Speaking of alcohol detox in particular, we have to kind of be a little more careful going through the early stages of the detox process because it tends to be one of the most concerning when it comes to some of the withdrawal symptoms. And we see people that come in with things like sweats and tremors, a little confusion, some falling risk, and then that can increase substantially just based on the person's individual genetics and their use history, where we can see things like hallucinations. So we try to very quickly getting the person on a taper of some sort, which is usually a type of benzo. Regularly we use Valium and Ativan. Those tapers, you'll talk with the provider and they'll have a plan on how long they would be. Typically we look at like 6-7 days, just depends on the individual and their needs. And then we also use a lot of those comfort medications that we have to help with some of those side effects. Medications to help with nausea, if you're having any discomfort and pain, some of those things that we can give to just help make you comfortable through the process. We really try to build that plan to be specific to each individual need. The reason why it is so important to make sure that you're in a monitored environment going through the alcohol detox process is because what I mentioned with the severity of the symptoms. When you get into hallucinations and seizures and delirium tremens, those can be life-threatening, and without that constant monitoring, without having us taking vital signs and monitoring for symptoms and seeing how you're doing, the check-ins with providers, we really can unfortunately see some negative outcomes that can come if you're not careful without that monitoring, trying to do it on your own or without professional help.